and welcome to Man Academy. I'm Paul Nelson. In this session, we're going to talk about where do you start? If you need help, if something isn't working right, if sex isn't working, you're not feeling normal, you're not feeling good, where do you go for help? Unfortunately, in our culture, it is very difficult. As we begin talking about this, let's make one thing perfectly clear. Your right as a patient, as a consumer, and as a human being is to have the best physical and medical health that you possibly can have. I think we would all agree that if your knee isn't working, a doctor should do his best to get your knee working so that you can walk again as best as you are able. The same thing goes with teeth or vision or hearing. When it comes to sex, let's make sure that we understand our right is to have the best functioning sexual organs that we can possibly get. I say this because there are many therapists out there, and believe me, I've had some serious discussions with them who insist, well, if someone's penis stops working, let's just teach them to have a new kind of sex. Let's just say that's what their body is meant to perform. But the fact is, nobody is setting up this artificial barrier of you have to accept that your body is like this when there is medical science that can help. I tell this to all my patients. Getting you an erection is really not that difficult. I hear from guys all the time, every week. The story goes something like this. They have some sort of erection issue or premature ejaculation, or they finally decide they need to go see a doctor to find out what's going on. They walk into the doctor's office. He talks to them for about 3 or 4 minutes. He tells them it's all in their head. He might give them a prescription for something like Viagra and sends them on their way. And the guys are like, it didn't help. Nothing's working. The problem is we live in a society and a medical system that is very difficult when it comes to dealing with sexual medicine. Why is it so complicated? There are a million reasons. Sports medicine, you could look at that. That's sort of an analogy to sexual medicine. When we get into sports medicine, we're dealing with a body that has to function really well. Anxiety issues, we're dealing with the mental game, we're dealing with all that stuff. However, when it comes to sports medicine and sexual medicine, that's where it ends. For example, if you were in sports medicine and a patient came in and said, I'm on the track team and I want to throw javelin, and the doctor looked at him and said, oh, you're a pervert. That wouldn't happen in sports medicine. And yet when it comes to sexual medicine, in our culture, we have a lot of shame, a lot of baggage, a lot of taboos. It's just a mess when it comes to cultural and religious thinking around the topic of sexuality. This gets in the way of dealing with sexual medicine. So you go to a family doctor. How much training did they get in sexual medicine? 0. Family medicine is about vaccinations, sore throats, runny noses. A family doctor was trained to be a generalist. It's possible they got a chapter on sexual function for both men and women, but that was about it. So your family doctor, mostly what he learned about how to treat sexual medicine issues for men came from drug reps. These guys aren't bad. They're doing their job. They go to a doctor's office, they teach the doctor about how Viagra works. And the doctor goes, oh, okay, I get it. I'll prescribe Viagra. The problem is the doctor really doesn't know how to use Viagra usually himself. He doesn't say, oh, by the way, you need to take it with an empty stomach. He's so uncomfortable with the topic that he gives you a prescription and he wants you out of the office. And frankly, he's only got a few minutes with you anyway. The doctor needs you in and out in a set amount of time. The problem is this doesn't mesh well with sexual medicine, where we need to slow down, we need to get a clear picture of what's going on, and we need to listen to the patient. If you go online today, or if you go to FrankTalk even, right, and you click on the physicians, many of those guys are sexual medicine surgeons. Their main thing is implanting penile prosthetics. That's great, we need those guys. But the problem is, untangling messed up hormones, untangling mental health issues, anxiety, depression, all those things affect sexuality. Surgeons aren't equipped to deal with that at all. And frankly, I don't think they should be. That's not really their job. So where do we go if we need a specialist? Good question. There is this whole field called sexual medicine specialist. For example, there's the International Society of Sexual Medicine. There's the Sexual Medicine Society of North America. There are all these sexual medicine experts. The problem is, it's a very small field. And there are usually only 600 or 800 doctors at these meetings. That's not very many. When you look at all of America, that means there are hardly any sexual medicine experts around. And then frankly, most of these guys are really sexual medicine surgeons. So finding a doctor who's going to be good with hormone therapy, mental health issues, premature ejaculation, delayed ejaculation, how to have sex, how to reclaim a fractured and destroyed sex life, they're not going to be out there. That makes it really hard for you, the patient and the consumer, to get the help that you need. So that's where I want to start with: where do you go and where do you get started when it comes to taking care of your sexual health and finding the help you need to solve your problems?